Hi, I'm Dr. Rahman, and welcome to Today's Woman. I'd like to tell you a true story. A woman was admitted to the emergency room with a hemoglobin of 4, signifying severe anemia. When asked about her period, she said her period was normal. But on further questioning, we found out that normal meant she was bleeding through pads and tampons on a regular basis, but she considered this her normal cycle. So now I ask you, are you bleeding too heavily? How do you even figure out, are you bleeding too heavily? There are a couple ways. You can just guess. But unfortunately, without a frame of reference, you don't know if what you're bleeding each month is too much. You can ask other women, but then again, if you don't think it's abnormal, why would you even talk about it? The other thing you could do is count how many days you actually bleed for. Now, it is true, if you bleed for more than 7 days, that's considered abnormal, but it's clearly possible to have excessive bleeding within the 7 days. You can count the number of pads or tampons that you use. That's another good method, but the problem is that it's very subjective. Some women feel the need to change frequently. Other women literally cannot afford to change frequently. The different pads have different absorbency, and it's hard to actually quantitate if it's normal or not. You can check your CBC, see if you're anemic. Check your hemoglobin, see if you're anemic. That's another great idea. However, you don't want to wait like the woman until you are severely anemic. The third is you could use something such as a Diva cup. A Diva cup can actually measure the amount of blood. One full Diva cup contains about 15 mLs of blood. And is that a lot or not? It's hard to know without a frame of reference. Just for your information, anything over 80 mLs is considered excessive menstrual bleeding. But then again, how do you know if you don't quantify? There is one other way, and that's to assess the amount of blood stain on your pads or on your tampons each cycle. And then by using the pictogram, you can estimate the amount of blood. This is an example. Now, obviously, the woman wouldn't need to keep all of her pads. She would just need to tally from day to day how much bleeding was occurring. So this is an example of a woman with a 4-day cycle, clearly within the normal number of days. This is a woman who thinks her cycle is normal, who does not change her pad or tampon every hour. Let's use the pictogram to determine if this is considered excessive or not. On day 1, you can see that she mildly stained a tampon, had one small clot. Small is usually defined anything less than the size of a nickel, and one mildly stained sanitary pad. Day 2, the bleeding becomes heavier. She now has moderately stained pad along with 2 moderately stained tampons along with another small clot. By day 3 of her cycle, she's now saturating her sanitary napkins and her tampons, and she's passing medium and large clots. However, by day 4, the end of her cycle, moderately stained pad and also moderately stained tampons. So to use the pictogram, you tally the number of tampons used, the number of sanitary napkins used, the number and the size of the blood clots. Each one is given a certain estimated blood loss. And then you tally this all up, and at the end you can determine if it's considered excessive. So looking at our example, there was 1 mildly saturated tampon, 4 moderately saturated tampons, 3 saturated tampons, 1 mildly saturated pad, 2 moderately saturated pads, and 2 totally saturated pads, 2 small clots, 1 medium clot, 1 large clot. Beside the number is the estimated blood loss associated with each type of tampon or pad, and then the total estimated blood loss. When we add it all up, the total estimated blood loss for this during this cycle was 100 mLs. Again, anything over 80 mLs is considered excessive. So this woman in a 4-day cycle bled more than what is considered normal. But what does 80 mLs look like? This container contains 80 mLs. 80 mLs is the equivalent of about 3 ounces or 5 tablespoons. To give you a better visual, this container also has 80 mLs. I'm going to pour it into my glass. So there you have it. That's what 80 mLs looks like. So no one should become anemic if she's bleeding less than 80 mLs per cycle. Now, this woman is bleeding more than 80 mLs per cycle in this cycle. She should be evaluated. She needs to see her GYN. Having a heavy period can be a nuisance, can be embarrassing, but more importantly, it can cause health risk. And if you think that you have excessive bleeding or want to figure this out, please do not hesitate to book an appointment with Dr. Rahman at www.drrahman.com. www.drrahman.com. That's spelled DOCTORRAHMAN.com. Thank you.